Hey everyone, it's Dr. Benton, and I've got Melissa Crenshaw here, melissacrenshaw.com. She is our local homeopath, and she has been an invaluable resource for the community, for my patients. I send her people. She's helped me out and with homeopathy. Homeopathy is one of those kind of things that people misunderstand. They get confused between homeopathic medicine versus integrative medicine or holistic medicine. But for me specifically, it has a special place in my heart because my children had vaccine reactions when they were little. My oldest one had neurologic reactions. My middle child had an autoimmune disease. And uh, the autoimmune disease was considered incurable as she had dermatomyositis, and the pediatrician said it's a classic case of dermatomyositis. And then, of course, at that point, I was just waking up to a lot of the issues that was happening in Western medicine as me as a doctor. And like I was realizing I was missing out on a lot. And so that was my first experience with a homeopath, Dr. Michael Smith. And he is a naturopathic doctor. And within 6 months, she was cured. And so when I took her back to the pediatrician says, I must have been mistaken, even though it was formally considered a classic case of dermatomyositis. So that was an eye opener for me. And gosh, that's worth its own story of just how even her father was skeptical at first too, but then be able to see how quickly it worked and how quickly the symptoms changed within seconds sometimes. Like one time I did a mission trip to Haiti and I'd left him with the kids and he had switched the remedies and she got worse. And he's like, I've had enough of your witchcraft. I am going to go to a real doctor. And like, she was fine before we left. So we realized he had switched the remedies. We gave her the right remedy that night. The next day, her bloody, scabby rash that was all over her body had disappeared. So that does not happen with placebo for a 2.5-year-old. My oldest one, definitely her brain issues got better. Her behavior entirely changed. I mean, I've been able to see it work in those chronic issues, vaccine reactions, autoimmune disease. The dog had seizures after a car accident, and the homeopathy stopped it with one dose. There were no more seizures at all. And then, of course, using it for acute care as well for like ear infections and strep throat and flus and COVID and, all the things. For me, this is one of my favorite medicines because it's non-toxic. It's safe in pregnancy for babies for all ages. You're not going to overdose. You'd have to choke on the entire tube of things to actually do anything harm to yourself, I think. So I am so excited to have Melissa here to go into sort of the science of it, sort of the history of it, some people's hesitations around homeopathy. I'm so excited to have you, Melissa.
Thank you so much. I'm so happy to be here. And so, a couple of things. Yes, the placebo thing that people like to say. Okay, well, if it was placebo, it's not going to work on animals, plants, bees, people who are incapacitated or even not fully there, in the hospital or whatever. So we see it still work, even though people or babies or animals don't know what they're doing. Love that you said witchcraft. He's not doing witchcraft anymore. That was something I really battled for a long time in the beginning of my using homeopathy and being a homeopath, is that people would say that this was witchcraft and I was practicing witchcraft. So I really struggled with that. As a Christian, I love Jesus. And I was like, my goodness, I don't want to go against anything. I don't want to be doing anything outside of his will. So I really spent time and in prayer but also just researching and trying to find out, where does this idea come from that homeopathy is witchcraft or that it's occult? The thing that I hear all the time still, I'll get emails and they'll say, my friend told me, or I saw in this YouTube video that Dr. Hahnemann, who is the founder of homeopathy, was a Freemason. And, that doesn't bother me, because if I'm going to stay away from every practitioner that doesn't believe the way I believe, even if they're a Freemason, if their occult practices aren't in line with mine, then I'm going to be narrowed down to just myself.
And this is
Right.
200 years ago. This is
Right.
200 years ago in Germany.
And his beliefs don't leak into my body when I use homeopathic remedies. Homeopathy was built on the science. He was a medical doctor. And he didn't like the practices back then, the medical ways were doing to his patients. So he wanted to make a different way.
Homeopathy versus allopathy as well.
Yeah,
Between, I'm not against allopathic medicine. I do it, and it's an
wow.
important distinction.
That's right. So homeopathy is based on the principle of like cures like. And so that means that For example, if you get stung by a bee, we might give you the homeopathic honeybee as the remedy to help calm those symptoms: burning, stinging, pain, heat coming from the site, where allopathic medicine is opposite. So an allopath is going or an allopathic medicine is going to give you something to stop those symptoms, where homeopathy wants to stimulate your immune system to cause your body to heal itself, right, and bring it out. So what
Right.
that looks like is it's not always, the symptoms aren't always just shut down. So if you have a flu, your fever might go up when you take a homeopathic remedy. And sometimes people freak out. That's a good sign. Fever is our friend. Fever works for, fights for your body. And if you try to shut down the fever and suppress it, then you create future chronic conditions for yourself. And I'll talk about that too. But that's the difference.
I'm giving antibiotics, antipyretics, anti-inflammatory, just the anti is against.
The other reason that Christians get scared of homeopathy is that it's energy medicine. And, we for a long time thought energy medicine means it's new age, but actually God made energy. We are energy. The earth is energy. So once we started to figure this out, I became like just more relaxed about energy is not bad. Okay. So here's the thing: just because the world uses energy in a way that we don't use it doesn't mean that it's bad.
Right. Well, I tell people it's like we have an EKG that measures our heart. It's literally measuring the electricity. The EEG, you can measure our body's energy like many feet away from us. Like it's literal science.
Yeah, it is.
So it's yeah. Once we understand we are filled full of water and electrolytes, we have sodium, potassium, magnesium, and that's what makes us electric. It's beautiful,
Yeah.
divine design.
Yeah, love it. And I love to teach one consultations, but I also love to teach families how to use homeopathy because I believe that you should be in control of your health care. So, again, my heart is always for parents who want to support their children well, but you might feel overwhelmed or unsure of your options. And so, what I hope to do through this little introduction is to help you understand what homeopathy is, how it's commonly and safely used, and how it can support many of the everyday illnesses that families face. So, this can be both in the moment and with long term health in mind. So, what homeopathy is, it's a system of medicine, of natural medicine, that's been around worldwide for over 200 years. At its core, it's the understanding that the body was made to heal. And when we support the body correctly, it can restore balance, and we call that homeostasis. Homeopathic remedies are made from all kinds of things, natural things, and we even make homeopathic remedies from diseases and yucky stuff because that's like cures like. So, because of the preparation, remedies are extremely safe, non-toxic, and which is why it's my first choice for people of all ages and stages of life. So the minute the baby is born, we could give aconite. While mom's pregnant, while she's breastfeeding, a 3-year-old man like my grandfather, I'm giving that man homeopathic remedies. It doesn't matter your age or your stage of life, it's safe. And one of the most important things to understand about homeopathy is that it's individualized. So two people can have the same diagnosis, like an ear infection, a sinus infection, or strep throat, but need two different remedy care plans because it's based on how their bodies are experiencing the illness. Because homeopathy doesn't treat the diagnosis, we address the whole person. So it's important to clarify what homeopathy is not, because this is confusing for a lot of people. Homeopathy is not herbal medicine or supplements. It's just different. It's a separate system of medicine. It's not about forcing the body to do something, and it's not suppressive. The goal is not to shut down the symptoms, but to support the body as it completes a healing process. So this is a really hard concept for people to grasp because that's what we've done. That's what we were taught to do. And I really hope to help you understand it in this little introduction. So the shift from how do I make this stop to how do I support the body through this is foundational to long-term health. So homeopathy works well because we often express symptoms very clearly. So you can see exactly how an illness is moving through your body, how quickly it came on, what makes it better or worse, and how you feel during the illness. This clarity helps guide the remedy selection, and homeopathy meets us where we are. So we're not forcing the body to bypass symptoms, we're supporting the body through through those symptoms. So parents often ask about safety, and that's a really important question. And when homeopathy is used appropriately, it's very safe. And they do not interact, homeopathy does not interact with medications. It does not suppress organs and does not create dependency. So there's a difference between simple acute care and deeper chronic care, and knowing when to seek guidance is important. So one helpful distinction is understanding the difference between acute care and chronic care. So acute conditions are short-term situations like cold, cough, flu, sore throat, headache, earaches, teething, stomach viruses, and those are important moments when the body is actively responding to an infection or a stressor. And then chronic patterns are situations where symptoms recur, linger, or shift over time. So frequent infections, recurring ear infections, eczema, anxiety, sleep disturbances, digestive issues that keep returning, like if you get bloated every time after you eat or you have acid reflux, and then or constipation, diarrhea. Acute care supports the body through an immediate challenge, and chronic care looks deeper at why the body keeps getting stuck in the same pattern. So how we handle acute illnesses play a major role in long-term health. And that's super important to remember. So I want to walk through some common things that we deal with and explain how a homeopathic practitioner thinks about each one of those. So, with respiratory illnesses, I'm looking at how the illness presents itself. Is the person restless or clingy? Do they want warmth or fresh air? Is the cough dry or loose? Did the illness come on suddenly or slowly? The goal isn't to stop the illness instantly, but to help the body move through it more efficiently and comfortably. So, we look at illness different than regular Western medicine, allopathic doctors. So fevers are one of the most misunderstood symptoms. And a fever that is due to illness is the body doing exactly what it's designed to do. The reason I say it that way is that if you have a fever because you were left in a hot vehicle for too long, that's not okay, right? That's not the body trying to heal yourself. That's a very different situation. But when you're sick with a cold, cough, flu, COVID, strep throat, that fever's doing a job and it's doing exactly what it's supposed to do. So rather than automatically suppressing a fever, homeopathy looks at how the person is handling it. Are they alert or lethargic? Are they thirsty or not thirsty? Are they calm or agitated? And supporting the body appropriately can often shorten the illness and reduce complications. Ear infections are so common in children, and especially after they've had a cold. So we look at the type of pain, how quickly it came on, whether the child wants pressure, comfort, or to be left alone, and how the symptoms shift. When the ear infections repeat themselves, that's often a sign that the body hasn't fully resolved the underlying pattern. I really believe that when ear infections are treated with antibiotics, and for the kids that keep getting ear infections, same thing with strep throat. It's not a new ear infection or a new strep throat. You just never got rid of the last one, really. So this is just this recurring pattern is where homeopathy really shines. And then teething can affect sleep, digestion, emotions, and even immunity. So some babies become very clingy and emotional. Others irritable or sensitive to pain. Homeopathy can support the nervous system during this phase. So I love how homeopathy works on the emotions and the nervous system. So children don't separate physical and emotional experiences the way adults do. Anxiety, sleep disturbances, mood swings, and behavioral changes are often connected to the nervous system and immune system working together. So homeopathy, again, takes a look at the whole person, not just the isolated symptoms. So I want to give you just a few remedies. I'm thinking like 3 remedies for each of these conditions so that you can take them with you and you can get started. If you need more help in an acute condition, you can always reach out to me and I can do an acute consultation with you. But if you want to learn how to do this on your own, to address these acute conditions and even chronic conditions for your family, then you can join me in the Inner Healing Circle. I also have a lot of podcast episodes on these subjects, but I'm going to give you a very quick rundown on some remedies. Aconite, Aconitum napellus, is great for that sudden onset anxiety, restlessness, often after a cold or exposure. Belladonna has the intense, fast-moving illness with heat, redness, and throbbing. Gelsemium is the slow onset with weakness and heaviness and the desire to lay still. And then remember that with fevers, we're addressing the fact that there is a fever present. We're not giving a remedy to reduce the fever because we know that's counterproductive. So fever remedies are belladonna is for the sudden high fever with heat and flushing. Ferrum phos for the earlier vague fevers. The person's still fairly alert and has very mild symptoms. Aconite again, fever with fear and anxiety.
Can I tell you two funny stories with a fever?
Yeah.
I learned how to not treat fevers when my kids were little from the naturopath. I can tell you, like, before they would stay sick for a week or two, when I alternated the Tylenol and Motrin like I was taught to in medical school. So then when I would let the fevers just run, they would be like done so much faster. But two very funny stories that maybe it'll stand out. Aconitum is like when they're the anxiety, the fear, right? So my oldest child, um, she had a fever of 104. This is probably when she was about 12 or 13. Her dad brought her over to my house. I don't know what to do with her. She's freaking me out. She's like, Mom, I want to go to the hospital. Go to the hospital. I'm dying, And I was like, I knew it was the flu. So I gave her one dose of aconitum. She was up making a smoothie 15 minutes later, and her fever had dropped by like to 100 degrees.
Love
Like
it.
15 minutes, incredible. And then belladonna. This was two different times. Again, my youngest had like fever of 103. That tends to be her fevers. And so I just let them run. I just hang out with her. This is the first time. And she suddenly, it's like she was hallucinating. She's like, water, water. And it sounded like she was talking gibberish, but almost sounded like another language. I'm like, what is happening with my kid? And she was like freaking out. Her face was flushed. She was running around. I was trying to chase her down. I was like, belladonna. I gave her belladonna. Seconds. She was like not acting crazy. I was still like, what was that? Because she'd never done that before. She was 12 years old. She'd never done this before. And then she did it again recently in the middle of the night. She's both times she's with me. It's kind of an interesting story. My husband was out of town, and so she was sleeping with me. She woke up. Longer story. I'll spare you the longer story, but same thing. She kind of woke up. She said, Mom, remember that time I had like that fever? I feel anxious like that. I gave her belladonna. It was like, so those are just when you think your kid's acting like crazy. I mean, I really thought my other kids were scared. The first time she had that, they were like hiding, and the kids are like, what's happening with her? Like they were scared, and belladonna got rid of it immediately, like seconds. It's incredible. So I just want to put that out there.
A lot of people are afraid of belladonna because of the whole Highlands teething tablet scare years ago. It was shown after all of the investigation and everything, belladonna is not causing kids to have seizures.
This also was a lot of the teething tablets are given around the same time as certain other treatments at 2, 4, and 6 months.
Yep.
And, that can also cause febrile seizures. So
Mhm.
that's something else to consider there. And it was like literally in the single digits of the number of seizures that they were talking about. So that's something to put into perspective. Also about the FDA is trying to go after homeopathy for so long, even though it's obviously they say it's placebo, but yet it's dangerous at the same time.
Right.
Like, it makes no sense. If you tell a non-integrative doctor about homeopathic belladonna, they're gonna think you're giving your kid actual toxins. So you just have to be prepared to say it's homeopathic, non-toxic, and maybe if they're not integrative, just say homeopathic remedy,
Yeah.
because they
Yeah.
won't understand that at all.
Really good point to remember. Yeah. The timing. Okay, ear infections, ear pain, ear infections, teething, and sleep. So belladonna is great for the sudden intense pain that's worse at night. Pulsatilla for the clingy emotional shifting symptoms, and chamomilla for the extreme pain, irritability, and the child that's inconsolable. Teething, chamomilla for the angry, screaming, nothing satisfies this child. Belladonna for the heat, redness, and sudden pain, and calc phos for the slow or difficult teething and growth spurts. And acute anxiety and sleep, aconite, again, for the sudden fear, panic, and night terrors. Pulsatilla for the tearful needs, and the tearful child who needs reassurance. And coffea cruda for the overstimulation and racing thoughts. Coffea is great for anxiety. A few little dosing guidelines. For most acute illnesses, lower potencies are commonly used, like 6C, 30C, sometimes C is very appropriate, but I stay within that range, 6 to 200 for acutes. And then the pellets can dissolve directly in the mouth. So for babies, you can stick a pellet right in the mouth. They're not going to choke on it. But if you're uncomfortable with that, you can put it in a little bit of breast milk and a spoon. or a little bit of water in a spoon and just let it dissolve and then give it to them that way. If they're having a bottle, yes, you can put it in their bottle. And if they're going to finish the bottle all at one time, you can give it by a syringe. I like syringe as a lactation consultant. I don't like syringe feeding babies, but if that's something that you're doing for some reason and you're skilled at it, you can do that. So, if possible, avoid food or drink 10 to 15 minutes before and after dosing, but don't stress if this isn't perfect. And this does not include milk. So your breast milk or your regular milk, we've been known to put remedies inside a gallon of milk so the whole family gets, if necessary, right? We're not doing stuff willy-nilly. Start with one dose and observe. If improvement begins, then stop dosing and allow the body to continue the healing. This is another hard concept for people to grasp because we're so accustomed to giving medicines on a schedule. We have to give that medicine until, for this full 14 days or 7 days or whatever it is. And it's not, we have to know that it's not the homeopathic remedy that's healing your body. Your body is healing itself because the remedy is stimulating your immune system and causing your body to do what it was made to do. You are made to heal. If symptoms return, you repeat the remedy. And in strong acute illnesses, dosing might be every 15 to 30 minutes initially, not all day, but maybe for an hour or two. And then as improvement holds, you space doses further apart. And once clear improvement is happening, then less is more. So if there's no change after 4 doses, reassess or reach out to me, and me or my team can help you through the acute condition. I want to give you a quick case study on recurrent strep throat. So I worked with this child who had recurring strep throat infections every 2 to 3 months. And each time the parents went to the doctor, they were given antibiotics, they completed the full course, the infection cleared temporarily, and then it came back again. So this cycle happened 3 times before the parents saw an acute homeopathic consultation with me. This time, we supported the child through the acute strep infection, which looked very different than what they were used to because symptoms didn't just disappear and go away the next day. So there's a lot of education in it that's kind of scary. Like, oh my gosh, there's still, 3, 4, 5 days later, throat is still sore. We're working through it. This takes time. So the parents did not use antibiotics that time, and the infection cleared fully and did not return for several months, which means because it did return, but it was longer in duration. That means we have deeper work to do to stop the recurrence. So because of the repeated history, we also began chronic care. And over time, the infection spread out from every 2 to 3 months to every 6 months or so, and then stopped completely. And this is why we address acute illnesses without suppression. Because when acute conditions are repeatedly suppressed, the body often expresses imbalance later as chronic illness. Let me give you an example. When you suppress a baby's eczema, they have a higher likelihood to have asthma or allergies later. And that's something even allopathic doctors will have noticed, that pattern. So homeopathy moves a person through the illness without suppression, and the goal is long-term health, not short-term gratification. And, I myself had chronic strep my entire life, 1 or 2 times every single year until I started using homeopathy. And now I haven't had it now for 25 years. So I've seen it, in my own self as well. The last thing I'll share with you is just the key takeaways that we're not trying to shut down symptoms. We're trying to support the body's process of healing. And when we think long term rather than short term gratification, we set ourselves up and our children up for stronger immune systems in the future. We also set them up and ourselves up for healthier nervous systems and greater resilience over time. Because think about this, if you're never sick, you never struggle. Just think about all areas of life. If you never have hard times, you're not resilient. You don't become resilient by having an easy life. And then homeopathy is a powerful way to partner with the body instead of fighting it. And so thank you so much, Dr. Benton. That's my presentation.
Yay. I definitely want to add a few points that I appreciate you talking about being patient with the shift of how it works in homeopathy versus an allopathic medicine, because I have found that when people come to me, because they think because they're going to come see me that they're never going to get sick again. And I'm like, that's not how this works. And that would be witchcraft, right?
Right? Yeah.
That's not how it works. We have to support your body, retrain your body. And in a crude sense, to get used to not having to be suppressed and expecting that. So I even remember when I first started doing the sort of homeopathic stuff with that doctor, my kids were sick all the time. Like they were fully vaccinated, they were sick. I felt like my oldest one, she was from the time put her in daycare, the September through March, every single week she had a fever. I'm like, what is up with my kids? You know, and that's when I ended up taking her to the homeopath. Actually, it's interesting. I took her to the homeopath. She ended up with like pneumonia and double ear infections in the first week. I freaked out. I'm like, oh my gosh. It's like, don't worry, just keep pushing through it. And then I'm like, really? Are you crazy? And then, lo and behold, she got through it, no antibiotic. And then she was a changed kid. Not just her, she was my oldest that had the neurologic issues. So she was kind of I would call her the quirky kid that wasn't able to socialize. We put her into daycare to socialize her because she was kind of fun and had some sensory issues. And she went from not only sick all the time, but actually sitting in my lap, calm, laughing where she was not laughing before. Her entire behavior shifted. Her brain was healing. I remember I just cried. I'm like, oh my gosh, I didn't realize how sick my kid was. Yeah. She had done homeopathy and then she was well. Incredible. Yeah, that was soon after that. Another fun story. At that time, I had finally learned not to use Tylenol. My middle child was 3.5 at the time, but I think I had some expired Tylenol. So she was all of a sudden on a Friday night. I was like a lot of other mothers. I was working 50 something hours a week. I was exhausted. So she's like, "Oh, mom, my ear hurts on a Friday night before bed." I'm like, "Oh my gosh, here's some ibuprofen." Like I was just like so tired. And so she woke up 45 minutes later, screaming, holding her ear, like screaming. And I'm like, oh my gosh, I had some lidocaine eardrops. I put those in her ear. Nothing. Sweet oil. I had put in some garlic eardrops. I mean, at this time, the ibuprofen should have kicked in. And I'm like, oh my gosh, like this is why people take their kids to the ER in the middle of the night. It's like I felt helpless. So I texted mine after. I'm like, hey, help! Like, what do I do? He's like, oh, that's classic belladonna. So I gave her a dose of belladonna. She started calming down. I gave her one more. She slept through the night. So then the next morning, she woke up kind of like, I was like, okay, let me dose it again, but let me tablet your ear the next morning. She had pus, blisters, blood. Never, honestly, still to this day, she's 16. I've never seen an ear that she had laryngitis. It wasn't just an otitis media. She had laryngitis, infection, inflammation of her eardrum. And she was in extreme pain. And so then, so I dosed her with the belladonna and then hours. So I would dose her. The next morning I looked, everything was better except she had like a little, looked like dried blood. The blisters were gone. It looked like she had fluid behind her ear. So that day she complained about every 7 to 8 hours. So that's when I would dose her. And then the next day I looked at her ear, totally normal. Like I wish I had a camera to document. It was the most beautiful case of like improvement with homeopathy, with laryngitis, something that, and that's the thing is that the AAP, the American Academy of Pediatrics, they recognize that we are overtreating with the antibiotics. So when you have a kid screaming in there, the doctor wants to give something.
What else to do?
And they don't know what else to do. And suddenly,
Yeah.
oh, it's viral. I'm not going to give you anything. Here, take Tylenol, which lowers your glutathione, which is your body's immune system. So we lower your immune system by treating it with Tylenol. And then your parents are feeling helpless. Now, thank God I send my kids to, the patients to chiropractors and do homeopathy, and they're better within a day,
Yep.
hours. Your basic cases are often can actually go that fast when it's like
Yep.
an acute, they've not been chronically ill. So I
Yeah.
just like that as an example too of like amoxicillin would not have helped her ear. Think I literally had lidocaine eardrops that did not touch her pain, Motrin that did not touch her pain. Aldana gone.
Yeah.
Minutes, incredible.
I've done all that too. I mean, everything you just said, the whole story, all the vaccines, all the ear infections, all of the antibiotics. And that's what got me into homeopathy is that when, after all of that for the first 2 years of his life, then he had severe gut issues. I go back to the doctor where I always went. And she says, oh, here, just give him this. I don't know. Well, I don't know what it was, Pepsid or whatever it was back then. That was in the 90s. And it didn't sit right with me. I was like, okay, this doesn't feel right. I don't know what I'm going to do, but it's not this. And I walked out just feeling helpless. I didn't know what I was going to do. But I found homeopathy and saw him get better. Then I got better from, anxiety, depression, and hormone imbalances. And I love what you just said, how you you dosed her as needed. When she started feeling bad again, you gave the remedy. That's what we do in acutes. That's exactly what we do. A lot of parents want a schedule. How often do I give it? They want it every 3 hours. When I'm helping somebody that's brand new to homeopathy, I'll often tell them, do it every 3 hours for today because it makes them feel better. I want you to get to the point where you can see, I took this remedy, I feel better, but now so just as needed is the perfect way to do it.
Well, yeah, I've seen it work. I mean, obviously, it works. There's a field of medicine in and of itself that can
Yeah.
work for so many things. And I'm very thankful for Western medicine when we need it. I had appendicitis. Believe me, I tried some homeopathy and acupuncture. I was going to an acupuncturist. I was like, I knew I had appendicitis. It was early. I tried some homeopathy, acupuncture, and it did calm it. But I was like, I was by myself with the kids. I'm like, and my husband was like with a men's group with no phone access. I was like, you know what? I'm just gonna go in. I just like I'm not gonna push it, and I'll just get my days taken out. Like maybe under different circumstances, we could have pushed it a little bit. I was willing to try and experiment on myself, but I had a surgery, time and place. I'm glad I'm alive, and it was a powerful surgery. I think it's the same. It was like seeing my kids sick all the time, and here I'm a doctor. I felt helpless, and and when I was looking at this, I'm like, I had total FOMO. He's getting my kids healthier. I went to school all these years, and I couldn't get them. Kids were sick. They were sick all the time. I was like, it's his own story, but it's all these stories that is that challenge. It's what builds resilience. All these challenges, my kids' reactions, is their illnesses that taught me to learn something else. I've been, of course, spending the last 16 years like studying everything I can just to not be just allopathic, and have more tools in my toolbox. But in the meantime, I'm so thankful, for, like I said, the fact that you're teaching. And the other thing I really love that you're doing, and it's something that my motto since I've been a doctor is to teach people how to take care of themselves. Like the word doctor means to teach, right? I'm not here to be your mama. Like you are the medicine woman of your house. And
Yep.
it's that we empower mothers that are the medicine women of the house to take that role back from medicine.
Right.
And then doctors when things fail,
Yep.
right?
Yeah.
We should not be the first people that you come to.
That's right.
Like we should be like down the line after you try all these natural remedies. Grandma remedies were there because grandmas were wise.
That's right.
It's really tapping back into the wisdom of the women. And I love that that's what your goal is, that's you're serving the community is empowering people to take care of themselves. That's beautiful. And I thank you so much for that.
Yeah, thank you. Thank you for what you do. I love that you have the integrative approach and that you have such a great clientele and people that you serve. The Inner Healing Circle is at join.melissacrenshaw.com or just melissacrenshaw.com. You'll see it on there too. That's where I do all the teaching. We have an amazing discussion group, so lively community, beautiful, amazing women, so precious. And events, we have events almost every week where I'm teaching live or doing a live Q&A. And then it's like homeopathy on demand in there. So all the courses I've ever taught are in there and you just do them when you want to at your own pace.
And in addition, like community service with the recent measles outbreak, and you
Yeah.
offer your information, you're offering your knowledge because you're not gatekeeping your knowledge. Like we're here
Yeah.
to serve people
That's right.
and support the health of our communities. And thank you so much for coming. And again, listeners, like if you're needing help, especially with the chronic issues, like obviously I do functional medicine at my office. We do acute some homeopathy, but at the sake if homeopathy is calling you, it's incredible. And Melissa is so skilled and her team. And I'm so thankful you'll do super well with her as well. So thank you very much.
Thank you. Thank you. Have a great day. Bye.